My name is Marilyn Tan. I am a clinical associate professor of endocrinology at Stanford University School of Medicine. I'm also the chief of the Endocrine Clinic at Stanford Healthcare, and my primary clinical focus is on diabetes and metabolic disease. My research is actually focused on type 2 diabetes and also hypoglycemia. Hypoglycemia is a condition where the blood sugar is low, and sometimes it can be associated with symptoms or not. The most common cause of hypoglycemia is in patients who are on medications for diabetes, and so this goes pretty well recognized. If you see a patient on insulin who develops hypoglycemia, you automatically look at medications. But what often goes undiagnosed is either vague symptoms of hypoglycemia or other vague symptoms where patients are not on medications that typically cause low blood sugar, and then practitioners may miss this. So symptoms can include feeling really nauseated or lightheaded or having blurred vision or having hunger or confusion. In extreme cases, actually, it could result in seizures or even death. It's a significant stress for the body. For patients who are not on insulin or medications that cause hypoglycemia, it often goes undiagnosed for a very long time. And so really it's up to an astute practitioner to look at the medical history and think about, are there other risk factors for hypoglycemia, particularly in these patients who don't have diabetes, where they don't have finger stick glucoses or continuous glucose monitors or routine labs to actually catch the low blood sugar. So really it's up to the patient to report a history of the symptoms and for the provider to think about what's on the differential diagnosis for these symptoms. People present to their primary care doctors with these vague symptoms. Once in a while, if somebody really does have a truly dangerous low blood sugar, they may be brought into the emergency department where that gets diagnosed, but really it starts at the primary care or basic kind of community provider level, and it's usually years before they present to endocrinologists. In the cases of cancer-related hypoglycemia, typically they are being followed by more specialists, and in this, especially with neuroendocrine tumors, then this becomes higher on the differential diagnosis. So really seeing a specialist that is aware that there's a possibility that there's some other underlying treatable condition is really critical. Typically, as the blood sugar gets below about 70 milligrams per deciliter, we start to have these counter-regulatory hormones that are in our body to try to raise the blood sugar. So things like epinephrine and glucagon, and that's your body's own defense against the low blood sugar or the usually excess insulin. Patients can experience things like shakiness, sweating, tremors, blurred vision, but really the symptoms can vary, and actually for patients who experience this frequently, they can have something called hypoglycemia unawareness, where they actually are having low blood sugars but are not even having symptoms anymore. I think it's important for us to increase the awareness about the fact that hypoglycemia can be caused by conditions other than medications like insulin or sulfonylureas. So for example, the congenital hyperinsulinism, usually that's diagnosed at the time of birth, but for example in our patient who had tumor-mediated hypoglycemia or tumor-mediated hyperinsulinemic hypoglycemia, there are other less common causes, and my area of research is actually in post-bariatric hypoglycemia, which is hypoglycemia as a result of various gastrointestinal surgeries. I would just like to increase the awareness about pathologic hypoglycemia that extends beyond that caused by insulin and other medications that may cause hypoglycemia, because very often these patients have very debilitating hypoglycemia, so not just to the degree of having car accidents or having seizures or being hospitalized, but really essentially being disabled, right? They can't work, they can't go to school, they can't drive, and so really it's taking away a significant amount of quality of life in addition to posing a large danger.